I do. I look around, I travel, I look around the world, and I see it's an interesting situation. In Russia, we think they have universal health care. But wealthy people in Russia, the middle class, are now getting private health insurance so they can get better coverage from better doctors. So they're coming down, they're coming up from universal health care into a combination system. We, of course, have mostly private health care, and we're trying to broaden our social network. So we're kind of coming down. But yes, I believe in universal health care, but I understand that private health insurance will always be a part of it because wealthier people can afford it. And by the way, between Medicare and Medicaid, we're already 60% there. You know, I explain that to foreign tourists that go by here, that we already are a social democracy. We already have taken a large step towards universal health care here.
Oh, absolutely. Yeah, the state, the citizens should have access to, and this is how it was in the villages previously. And we see in Europe where these systems are implemented that health care is provided for all the citizens. It should be that way, because then what happens is people are dying unnecessarily because they feel like they can't afford medical care, but everything should be provided for the citizens.
I do, yeah. Absolutely.
Definitely.
I mean, everyone should have the right to health care. It's a human right.
Yeah, I think we should.
I feel like there's more than enough resources if we were able to stretch them effectively. I feel like they're just concentrated and made into this like expensive, hard to reach thing. Mm-hmm. But it doesn't need to be that way. Like Canada is a prime example, England, all throughout Europe. I work very closely with Europeans, and it's so bizarre to them that we pay for healthcare. It's very baseline. It should be, at least.
Canadian perspective yet again. Yeah, it just makes a lot of sense. It's worked for us, even like as a social equalizer. It's been helpful for that, knowing that like your health situation is not linked to your job, and like there's less precarity if you're in like a low-wage job or a job with not great benefits or unemployed or not of working age. And also just the total costs in healthcare, if I'm remembering correctly, it's much less. And even the cost of drugs, that's something that comes up as well. The cost of medicine is lower in Canada just because of the system that's in place. And also, like, I should really point out that it's far from perfect. Like, there's stuff that's not covered, like glasses. Dentistry isn't really something that's under that umbrella, but like for what it is, it's amazing. And I think, I mean, Canada and the US have a lot in common. I don't see why it wouldn't work here.
Absolutely. For me, I'm from England. I call America my home and I live here, but I'm from England. I can tell you right now that my life was saved in England because of universal health care that is present in England. Not every system, all departments in government are never perfect, but universal health care is the kindest one because it makes sure that someone's life is not on the line because they do not have insurance or because they cannot afford health care. Providing universal health care also means that citizens do not have to sell their homes if they themselves are sick or because one of their family members are sick. Universal health care is as simple as saying, should we provide clean air to everyone for free or not? Universal healthcare is a basic human right. If a country wants to have the identity as a first world nation, then the first priority to make sure that every citizen in the country is provided healthcare. Of course, preventative measures for healthcare should also be taught in schools and parts of education. But if someone does get sick, then universal healthcare should allow them to make sure that they can stay alive and healthy.
Yes. Why not? Why? I feel like that's such a crazy question. Not like you're crazy for asking the question, but the fact that that's even a question that's like hotly debated is just ridiculous to me. Everyone should have access to healthcare. Everyone. Yeah.
I do. I mean, I feel like people who are underprivileged should also need to have access to healthcare because it's human body. We don't know what's going to happen the next day. So people should have, government should be able to give some kind of protection, some coverage so that people can go to a doctor, just not even like dying of small diseases or don't have to suffer a lot just because of a common cold or let's say a simple disease or something.
Yes, but we come from the UK where we have NHS, so we believe everyone's entitled to healthcare. I do not understand how you can function with private care over here, which is maybe what is the big underlining factor of this society.
Yes, of course I do, but I don't think that'll ever be possible because just of the economics, that I think that'll never be possible.
I just, personally, it feels kind of straightforward that the government should be taking care of its people, that people should be safe and...
Like healthcare is a human right.
Healthcare is a human right, just it's the way that you protect your people is to make sure that they're able to live their lives,
Yeah, I would completely agree. I mean, my opinion is biased because I'm from the UK, we have the NHS. So yeah, I completely agree. Everybody should have access to free healthcare, regardless of where you're from.
Yes, I think without a question that healthcare should be a right. I think the fact that I see people, pregnant women, babies who come in and their families are going bankrupt because they can't get care, or their babies are sick and they miscarry because they couldn't get the prenatal care in time, or the fact that you can be in a situation where you can't afford chemotherapy. I think it would be cheaper and more efficient to do it, and I hope that we get past this point of not having universal health care.
Yes, I do. I think it definitely sets people apart. It literally murders people that are poor if they can't afford basic health care. It's very sad.
I think people should receive health care regardless of rich, poor, ethnicity, all of that. I think everyone should, it's a right for humans to receive some kind of health care. I also think there should be more emphasis on public health and how to properly stay healthy, so not as many people will need to use that free health care, thus lowering, overall taxes, lowering overall, however money is spent on health care, it should be used only when absolutely needed. That way those people who really don't have the ability to get health care can.
Yes, I do. Everybody has the right for health care. My slogan from my last job is health care is a right, not a privilege. So no matter woman, man, child, you deserve that health care. Not just because, oh, you're sick, it's a $400 visit. No, that's not right. We shouldn't profitize over that.
No. I think people should have emergency health care, but they should have insurance that they cover them if you could afford it. If you can't afford it, then it's okay to have Medicaid. But I think it's being abused by a lot of people.
Yes. I think everyone has the right to a good quality of life, and no matter which way universal healthcare is achieved, it's important that we all have the opportunity to equal healthcare.
Yeah, I think they have universal healthcare in Europe more so than here in America. In America, I think it's just a money racket for insurance. Yeah, I'm not sure. But yeah, I believe in universal health care for free health care for all, so everyone's not going in debt for an insurance racket or something.
Absolutely. Because health is a human right, healthcare is a human right. And because we're also we're a highly developed system, we're an industrialized nation, why shouldn't we provide health care for everyone?
Yes.
I think that's a basic tenet of life, that everybody should be able to have the basic things like a roof over their head and health care and education.
I think for the most part, yeah, I don't agree with a lot with how like some of them are saying we should go about it and how we should implement it, but I think the idea is solid. I think the idea is, I agree with the idea. I don't agree with the implementation a lot of people have portrayed so far.
Yes. I think health care should be free to everybody.
Yeah. Hell yeah.
Yeah.
Ideally, yes.
Yeah,
it's
it would
just
be
hard to implement with the system we have.